I am Ramona and welcome to Ramona Interviews. And with me in the chair today is Dr. Jared Faucher. Welcome.
Thank you.
Tell us a little bit about your experience into, I say geriatrics, but there's another word for this specialty, and what is that?
Well, we call ourselves geriatricians.
Geriatricians. Okay. Tell us a little bit about your education.
I was educated locally. I actually went to Holy Cross for undergraduate. And I went to Lake Erie College of Osteopathic Medicine, which is in Erie, Pennsylvania, for medical school. And following that, I actually came back home to Worcester. I did my residency training at St. Vincent Hospital, which was 3 years, plus I had stayed on an extra year to do a chief residency year. And then I recently finished my geriatrics fellowship training, which I did over at UMass Memorial. And I finished that about a year ago, and so now here I am.
And where are you located?
I currently practice at Grove Medical Associates, which is in Auburn, Massachusetts.
And what's their website?
It's grovedoc.com, so that's grovedoc.com.
And your telephone number?
It's 508-753-2060.
And tell me a little bit about your practice. Are there other physicians that work with you?
Small private practice. There is myself and there are 3 other doctors, Dr. Kelly, Dr. Murphy, and Dr. Weinstock. We also have a physician's assistant who's been there for quite a long time. So the 4 doctors and the 1 PA.
Public outreach, you said that you had done some work at senior centers from September to into the spring. Tell me a little bit about what you talk about when you go out, and what are those topics?
Sure. So I actually went to several different senior centers around the area. I was in Oxford, Auburn, Worcester. And one of the biggest talks I gave was on salt and hypertension or high blood pressure, which is kind of a huge issue because it's something that's very prevalent and applicable to pretty much anybody, but I don't think everyone has a good understanding of how that plays into their lives. So, you know, salt, everyone says, well, the common answer is, oh, I don't add any salt to my food, which is great. But unfortunately, you know, probably 75-80% of your sodium intake isn't from the salt shaker. The 2 biggest culprits are actually restaurant food and processed foods. So anything that you buy that's frozen or canned, oftentimes it's very high in sodium because of the preservative factors and flavor. So unless you're very careful about what you buy and what you're eating, you might be getting very high doses of sodium in your diet, which will cause you to retain fluid and ultimately increase your blood pressures. So what I tell people is if you can keep to a 1,500 milligram per day sodium diet, which generally all of my patients should be on regardless of their medical issues, if you can stick to that, you might be able to get rid of some of your blood pressure medications, because some of these people are on 2, 3, 4 blood pressure medications and they're still not well controlled, and they're like, why, you know, is this happening? What's going on? Oftentimes it's something as simple as dietary changes can make a big difference. So I tell people that while I can't guarantee they'll get off their blood pressure medications, there's a good chance that you'll at least be able to cut down on the dosing and maybe cut down on the number of meds that you are on. So that one, I think people found pretty illuminating because I don't think they realized how much salt was actually in, you know, restaurant foods and the processed foods. So I encourage them to, you know, get involved, read the labels, which tells you exactly how much sodium you're getting. The problem with restaurants is that you don't have the labels. So, and even if you ask them for low sodium things, whether you actually get it, it's hard to say. So my patients who eat out 3, 4, or 5 times a week can be a little bit challenging. Yeah, there's a few different factors going in there. So one, convenience. So sometimes if people aren't able to get out to the supermarket very often to get, you know, fresh food, you know, they often are reliant on things that they can store for long periods of time. So frozen foods and canned foods. You know, the other thing that goes to that is as you get older, it's natural that you lose some of your taste sensation. So people, because your sense of smell and your sense of taste actually goes down. So to kind of supplement that, people will start eating things that are more heavily seasoned and salted because they just aren't tasting the foods that aren't as much. So there's a couple of different things at play there. I talk on dizziness I went out actually with some of the physical therapy people from St. Vincent Physical Therapy that has a branch in our building, and we talked about the different kinds of dizziness, when you should be worried about it, when you shouldn't be worried about it, how to manage it, because that's also a big issue, with my patients, whether it's because they have vertigo or they have issues with medication side effects, which is probably the biggest one that causes dizziness. Is they're on blood pressure meds that the doses either recently increased and they're not tolerating it, or they're just simply getting older and they're metabolizing the drug differently, and now their blood pressures are lower, or they're getting dehydrated because some of the diuretics can do that. So it's kind of a way of explaining to people the different types of dizziness, which there are. Like I said, vertigo is a little different than being lightheaded from a blood pressure medication.
So what's vertigo?
So vertigo basically is, the way I would describe it to people is, if you felt like the room was spinning around you, and whereas lightheadedness is more, you feel like you're going to pass out, you feel kind of fuzzy and woozy, things are kind of getting dark, like you're going to pass out.
Is there like a common myth that people always think something is one way, but it's really not?
Well, I think there's a lot of people have the common misconception that I'm getting old, so this is normal. And that's not necessarily true. There is normal aging, but there are a lot of things that are common in older age, but I wouldn't say are part of normal aging. So, arthritis pain is extremely common. I don't know that I would necessarily categorize it as normal aging, though, because there are people who do not have arthritis. A lot of my female patients will completely ignore the fact that they're having issues with urinary or bladder incontinence. They don't even mention it to the doctor unless the doctor specifically asks. And a lot of this, I find, is that women think it's completely normal that they're having loss of bladder control, leakage of urine, that type of thing, because it does happen to a lot of women, especially women who have gone through childbirths in their earlier years. It happens quite a bit, but it doesn't. It's not a normal part of aging, and there are things that can be done about it. Dr. Jared Faucher. The other doctors in the practice are John Kelly, Dennis Murphy, and Dave Weinstock, and Andrew Mooring is the physician's assistant.
Thank you so much. It's been very enlightening, and we hope to have you back again. I'm sure there are numerous other topics that come up in your field, as it is a growing field, and we wish you much success.
Thank you very much.
Thank you. I am Ramona, and you've been watching Ramona Interviews. Have a healthy week.